right. Hello, and thank you for joining us today. We're here to talk about the CDC Public Health Associate Program, PHAB. I'm Tracy Seward. I'm the Senior Director of Outreach and Recruitment for the Association of Schools and Programs of Public Health. I'm really excited to be here with my colleagues from the CDC to talk about this program. So a couple of housekeeping items before I turn it over. You'll be able to ask questions at any point through the Q&A box at the bottom of your screen. Just click on the Q&A button and type the information on the pop-up. And we will take the questions, we will answer them at the end. And also, we get this a lot, the recording will be made available for you after the webinar. Usually you will receive a copy within a week, and it will also be on our website here once it is edited and ready to go. With that, I'm going to turn it over to Pam Craig from CDC.
All right, next slide. Okay, good afternoon. As Tracy indicated, my name is Pam Craig, and I'm a member of the Partnership and Education team under the leadership of JT Theophilus. He's online with us also as well. One of the things I'd like to start with is, what is your knowledge of PHAB? A, you have no knowledge of PHAB. B, I've heard of PHAB. Or C, I'm well informed about PHAB. If you would, place those answers in the chat, and JT's gonna look at that with it. And oh, we've got our poll, it popped up. So I'm gonna give you a moment to respond to our poll. Thank you, the answers, they're coming in, our responses look good. Okay, we've got quite a few, a lot of A's. I have no knowledge. B's, I've heard of it. Okay, looks like it slowed down, Tracy, thank you. So it looks like most of us either have no knowledge of Public Health Associate Program or you've heard of it. Next slides, please. What we're here today is to talk about those that are candidates and what is PHAB. This is PHAB, what you see on your screen. PHAB is made up of all different races, ethnicities, and genders. And it is each and every one of us that's on this call today. This is PHAB, as you can see. And PHAB, most of our PHAB average age is about 26 years old, because they're right out of either undergrad or the master's program. But it is their first professional public health job. So this is, you are PHAB. Next slide. Okay, what you see here are some of the potential duties, responsibilities that you could possibly be exposed to based on your subject area that you're matched with PHAB. And anything from emergency preparedness, contact tracing, respiratory fitness, working on a community project with the elderly, with teens, even some in the school, even working with childhood obesity and community programs dealing with that as well. But PHAB has a large variety and a breadth of subject areas that you could potentially be matched with. Next slide. Now, if you can see, this person is way out somewhere in Wyoming on a flat open plain. He is PHAB. You could be placed or matched with an area that is rural, that is away from, of course, away from home, but you would be out in the field getting hands-on technical and academic experience. So that person that you see way out in that field, he is PHAB, and that could be you. You could be PHAB. Next slide. One thing I like to talk about is the Public Health Associate Program. And again, the acronym that you hear over and over is PHAB. It's a 2-year paid competency-based training program. Associates are federal employees while they're in the program. They're considered FTEs, federal employees. And there's a partnership and a collaboration between CDC and the host site. The host sites, they are hosting you out in the field. And those host sites can come from state, tribal, local, and territorial health departments, as well as non-governmental agencies called NGOs. Next slide. the mission of PHAB. The mission, as you can see, yes, indeed, it is to provide training and an exponential early to learning and early public health professionals who contribute to the public health workforce. But more importantly, you are to add value to the subject area and the host site and the city and state where you have been placed. That is the main mission, and it is training so you can see and do and learn. Next slide. Now let's talk about what PHAB is not. PHAB is not an internship. An internship is typically an unpaid high school student, a college student, where they're going in doing kind of like office or entry-level admin type jobs. But again, it's non-paid. Some of them are even volunteer. This is not an internship, nor are you supportive administrative staff. Those are, anyone could sit and take notes or create maybe a spreadsheet with name sign-in sheets. That is not what a PHAB associate is. They do not do supportive administrative staff, making sure that there's enough paper in the copier or making sure that there are enough pencils and pads. That's not what PHAB is. And PHAB is not a federal government employing service. In other words, we are not a staffing service. Even though there's opportunities at the end of the 2-year training period for you to compete competitively or convert competitively into a CIO, that comes at the end of the 2-year training program, but it's not a guarantee. So PHAB is not a staffing service for the federal government. And lastly, PHAB, you would not be CDC subject matter experts because this is a training program for entry-level, early career public health employees. So you would not be considered a subject matter expert after the 2 years. Will you have a lot underneath your belt? Absolutely. But more importantly, you're there to see and to do and to learn. Next slide. Now let's talk about the 2022 competency domains. Initially, there were 9. And as you can see, you can read that, the analytic and assessment, public health science, program planning, management and improvement, public health law, professionalism. Many of these competency domains are things that you bring right to the program. Know how to speak professional, know how to write professional, science-based communication. You would learn more about health equity and community dimensions of public health and public health funding. Now we've added 2 additional domains. Initially it was 9, now it's been expanded to 11. And JT, if you would you explain 10, evaluation, and 11, which is the public health emergency preparedness response?
Absolutely, Pam. Thank you. The evaluation component is just a component of looking at the strategic analysis of evaluating the effectiveness of a program. It is looking at components of data collection, data analysis, reporting back on some of the evaluation findings that you might be involved in over the 2-year duration of the program. We'll also have some academic training throughout the 2 years in addition to your experiential training at the host site, but we'll actually teach you a little bit about the evaluation process. Again, as Pam mentioned, this is not to be a public health subject matter expert, but to give you some exposure, give you some experience, give you some ideas of what it's like to work in the field and understand the aspects of evaluation. Public health emergency preparedness and response is very critical, especially right now. Most of you have heard, if not everyone have heard the word COVID and coronavirus. This is among us right now. This is something that we will have the associates in the program are deployable, or they would actually leave their term of 2 years for a period of 60 days to work on a public health emergency response, which COVID is among us now. So we would actually take you from where you are located, replace you into another location, either in your own host site working on coronavirus, or at the federal level, or in Atlanta here at CDC, but we would pay for all of your transitions and all of your living expenses during this 60-day period, and give you exposure to what it's like to respond to a public health emergency. You might work on the Joint Information Communications Center, you might work with policy, you might work with the state and local health departments, you might work with federal pharmacies, national pharmacy chains, and so forth and so on in the public health emergency preparedness and response domain. But those are two new domains that we've added for 2022. In the materials that we will send out after this call, you'll have a link to the PHAB website, which will actually list the specific competencies within each of these domains. So you get a better idea of what's expected of you over the 2 years. Someone says, JT, this is a lot of material for 2 years. Keep in mind, we pace it out. Be patient through the 2 years. We'll give you experiences on communication, on writing a report, on delivering a presentation, on working with the community and stakeholders. You'll have opportunity after opportunity to actually participate in activities at your host site that will give you an opportunity to meet the competencies. Our goal is that you succeed in this program, not that you fail out. We do not want anyone to leave the program once you're in the program. So we will do our best to make sure that you have opportunities to meet the competencies over the 2-year duration.
Excellent. Thank you, JT. And Tracy, do you want to answer some, is it okay if we answer some of the quick questions that were in the chat box? Or
Go for it. Yeah, if you wanted to.
Because there's one good one. JT, someone asked, you mentioned the average age being 26. Do you accept folks in their 30s? And the answer to that is yes. We accept candidates in their 30s and we've had some in their 40s. But it typically is your undergraduate or your graduate student that is just early career and less than 2 years out of the program. So to answer your question is yes, we do accept folks in their 30s. We welcome you because age, even though that's the average age, but it's not limited to.
Let me also add, Pam, too, that those are the more traditional students that Pam is referencing coming out of undergraduate or graduate school. We have sometimes the non-traditional student, someone who may have gone back and gotten a degree later in their life, whether it is a master's or a bachelor's, it doesn't matter. Sometimes we have folks in their 50s. We've had an individual in their early 60s who's applied and became an associate. So age is not a limiting factor. Please do not consider age as a limiting factor. The criteria is that you've got to be early in your public health career, not necessarily in your career overall, but early in your public health career. As Pam mentioned, the criteria is that you've got to be within 2 years of graduating from your most recent degree, either an undergraduate or a graduate degree. If you have more than 2 years of experience or more than 2 years out of your most recent undergraduate or graduate degree, I'd recommend that you look at a site on the CDC website, which is cdc.gov/fellowships. And I will put it in the chat so you can actually have access to this. This will outline about 42 to 44 training and fellowship and internship programs across CDC that address the different levels of experience and education. PHAB is the largest. It's the largest training program at the Centers for Disease Control and Prevention. It's not the only program. So if PHAB is not the best program for you or you don't fit the criteria, there's a lot of other options and available opportunities for you to pursue a training, fellowship, or internship through CDC. I will put it in the chat so folks can have it as well.
Thank you, JT. Another good question we had, can this program, is it completed worldwide or is it limited just to the US? It is the US and US territories. It's not an international training program. It is specifically for the US and US territories such as Puerto Rico, US Virgin Islands, Guam, and the Maritime, Saipan. And we've got quite a few other questions. So I think we might want to go back to at the end, JT, and then we can.
Yeah, let's do that, Pam. Let's go to questions at the end.
Excellent questions, though.
Yes, let's do that.
Okay. All right. Thank you. Next slide. Okay. The benefits of being an associate. And JT already alluded to some. The CDC, again, it is a paid 2-year training program. And you get salary and health benefits, meaning your health, your vision, your dental, you get all the benefits of a regular federal employee. It's really a great opportunity. You get also an opportunity to develop transferable career skills. One thing about the CDC, and as an associate, you have access to a wide breadth of training, and information is right at your fingertips. We have, and there are courses that you have to take in order to complete the 2-year program, but there is a wide, vast, deep variety of career training skills that are right at your fingertips and you can take online. The 2 years that you'll spend at your host site, it's hands-on with public health experience. And you'll be working alongside doctors, epidemiologists, scientists, depending on the subject matter area where you're matched. The training at CDC is in the field because you'll be considered field service staff. You'll have supervisory support. So you won't just be out in that wide field where you saw the little guy sitting on the plane in the wide open plane by himself. You're never alone. You would have your host site supervisor, and many of them have a primary and a secondary. And you also have what we call our PHAB supervisors. And many of our PHAB supervisors are alumni of the PHAB program. So they're graduates of the PHAB 2-year training program. And then you'll also be matched with a mentor. We have plenty of safety nets and support from you all the way around. When they say a village, you literally have a village at your fingertips. But your mentors, they'll be assigned and matched with you. Not necessarily someone that's in the same program area, which is probably best so you can look through the eyes of another program, but also they share their vast experience, but they're a mentor. So you have your host site supervisors, primary, secondary, you have your PHAB supervisor. They are a very good support tool for you. And then you'll have a mentor assigned as well. And more importantly, you get valuable work experience in respected and notably and really celebrated federal agencies that do a lot of really unbelievable work in the communities as well as at the state and local level. And you'll be working with highly qualified competitive career positions. So you will be competitive to compete for higher career positions at the end of your 2-year program. So there's a lot of really exciting, what I find exciting information that's at your fingertips, as well as experience and a really good line of sight for your future career opportunities. Next slide. Okay, our public health emergencies responders. This slide is really just showing you some of our PHABers and where they've done. In 2015, we had a major Ebola response. So we had people that were deployed for those responses. In 2016, 2017, Zika. Many of them were deployed and sent to Puerto Rico. In 2019, there was a measles outbreak. Many of our associates were deployed and were very, very helpful in responding to the measles outbreak. And of course, in 2020 and now, the COVID-19 response. And we've had over 300 associates that have responded. And the exciting thing about it is once they have responded to one of these needs, they always want to sign up and come back again for a second round of responses out in the field. So I think that's admirable to have over 300 associates that have responded to these needs out in the field. Next slide. I'm going to turn it over at this time to JT, and he's going to talk about the BestFit Model, which are the characteristics for PHAB candidates. JT?
Great, thank you, Pam. I appreciate it. This is a very important section of the discussion. This is going to talk a little bit about the characteristics of you as candidates and if PHAB is the best fit for you at this point in your careers. I'm seeing a lot of questions coming into the Q&A about degrees and so forth. Let me reiterate, you have to have a bachelor's degree within 2 years of the application year. The actual degree that you receive is not relevant. You do not have to have a degree in public health. You do not have to have a degree in science. You do not have to have a degree in molecular biology. You can have a degree in violin studies as long as it's from an undergraduate school or graduate program. There's an accredited college or university. It's got to be received after July 1st of 2020 and before July 1st of 2022. That is the window of the application for this year. If you're outside of that, or you're not going to get your degree before July 1st of 2022, then you can eligible to apply next year in next January. We have the application cycle on an annual basis. So the type of degree is not relevant. It's that you have a degree from a 4-year accredited college or university. Okay, that is the key aspect. We'll go through some more questions in the Q&A at the end of the session. What I wanted to talk about now is the best fit model. The best fit model are characteristics that you as potential candidates can think through and analyze your own well-being and your own sense of self and think, is PHAB the best fit for your next step in your career? So we put it into an acronym. We call it the best fit model. The B of the model stands for a big picture thinker. If you think of your own self, do you have a sense of thinking in the bigger picture of public health? Do you have a sense of thinking of how your work can impact the bigger picture of the health and well-being of those constituents that you work with, both at the state level, the local level, the federal level, and the global level? Many times in public health, we will work diligently, but we'll never see the fruits of our labor come to fruition. That's why it's important to realize that the work you do at your host site or in your career might not be realized during your tenure, but the fact that you have input and you have an opportunity to add value to your host site that might be brought to fruition in 2 or 3 or 4 years from now is a key aspect. If you're somebody who likes to see a quick return for your investment of time or energy, you might want to think a little bit about PHAB as a program for you. But if you're somebody who thinks about the bigger picture and somebody who thinks about the contributions that you can make and the value that you can add throughout the process, PHAB is a good program for you. Okay. The E of the model stands for effective communicator. We don't need somebody to orate and be a vocal presentation giver. All we want someone to do is be able to communicate in verbal or oral skills as well as the written word. Can you string 2 words together and make a complete comprehensive sentence that conveys a message? Or are you somebody who tends to ramble or stutter or not actually have the good communication skills? We can help build those skills, but you've got to have the basics of effective communication, both written and verbal or oral communication skills. We'll ask you to be able to, one of the competencies that we spoke about earlier, we'll ask that you actually deliver a presentation. It doesn't have to be to a massive audience. It could be to your host site supervisor and a couple of individuals that are at your host site. It could be to general stakeholders. It could be to the supervisor who you are working with and so forth. But can you deliver an effective presentation verbally and in the written word? The S of the model stands for socially and culturally inclusive. Socially and culturally inclusive. This is a key aspect that we consider health equity. If you go back to the domains that we spoke about earlier, health equity is a domain, meaning do you have the capacity to appreciate and understand that the United States and the US territories are made up of very diverse populations, racially, ethnically, culturally, professionally, philosophically, socioeconomically, gender-wise, sexual orientation-wise. There's a variety of individuals that make up the United States. We have to be able to respect and encourage cultural inclusivity and socially to be aware of those differences and to respect those differences. Inevitably, you will be matched with an environment that is different than you are where you come from or where you are raised in. So we'd like you to be able to experience a different culture for the 2 years or a different socioeconomic level than what you're used to be able to experience public health. If you're somebody who understands that, respects that, encourages that, this is a good program for you. The T of the model stands for thriving in a dynamic environment. This is a very key aspect of the program. The program is very dynamic. It changes on a regular basis. It is the federal government. As Pam mentioned, you will be a federal government employee for the 2-year duration of the training program. You will be a federal government employee. You will be based in the field, meaning you're not based in Atlanta at headquarters where CDC is housed, but you'll be based in the field. You're what we term as a field assignee. A field assignee, meaning you're based in another location outside of Atlanta, but you are an employee of the federal government. You receive your benefits, you receive your health, your salary. You're an employee of the federal government, but you're based in the field. The program is very dynamic. As Pam mentioned, we've had many associates that have actually been deployed for a period of 60 days throughout the 2-year term to help support the COVID response efforts. Sometimes the request comes in very quickly. Sometimes we'll make sure that there are changes that need to be adjusted to fairly quickly and fairly effectively and efficiently to make sure that the needs of the public's health are addressed. PHAB sometimes is a program that will say, we'll encourage you to wait until the application opens, and then we'll ask you for information and we'll give you a very short turnaround time. Those are natures of the program and aspects of the program that if you're somebody who likes to see A after B after C and within a certain period of time, this program might be the death of you, okay? It might not be to your best interest. But if you're somebody who enjoys the dynamic environment, enjoys experiencing new things, enjoys getting to meet new individuals or experience a socially or culturally different community than where you're from, this is a great program for you. The first F of the model is, and BestFit, is flexible. This is a program that is very dynamic. As we said, you've got to be able to thrive in a dynamic environment and be flexible and adapt to changes with a positive mental attitude. The program will flex and bend. We'll ask for information, we'll delay the response, we'll get you something, we'll ask you to get something back to us fairly quickly. That's just the nature of working for the federal government. We ask that individual candidates be flexible and be able to adapt to changes within the actual program and maintain a positive attitude. Like I said, if you're somebody who likes to see A after B, week 1, B after C, week 2, and no deviation from there, this program might not be the best fit for you as a person. It might not be that public health is not the career for you. Of course, we're not saying that, but this program may not be the most effective program in your career as you progress through. The I of the model stands for intelligent. As Pam mentioned, there's a couple criteria for individuals to apply. Number 1 is that you have a degree from an accredited 4-year college or university, either as an undergraduate or a master's degree at a minimum. You've got to be within 2 years of your receiving your recent degree, and you have to have a 3.0 grade point or better. 3.0 grade point. This demonstrates the capacity that you have to demonstrate intelligence. You have the capacity to learn academic principles and theories and so forth that you can actually accommodate to those academic institutional learning experiences. So you have to have a 3.0 or better. You've got to be a US citizen, a US national, or a permanent resident to be eligible to apply. And repeat those. You've got to be a US citizen, a permanent resident, or a US national to be eligible to apply to PHAB. Those are 3 very important aspects. If you are unfortunately not one of those 3, then your application will not be considered. But you've got to be a US citizen, a permanent resident, or a US national in order to be deemed a potential candidate for the program. Okay, so that's I of the model. You've got to demonstrate intelligence. The last T of the model is a tactile learner. Tactile learner is a hands-on learning, somebody who likes to do, not somebody who just likes to study and learn academically or philosophically or programmatically, but somebody who likes to get their hands inside and actually work at the actual concept that you may have learned in school, is to actually apply those skills and do the work that is actually required at your host site. Okay, actually to do the work that's required at your host site. As Pam mentioned, I think probably about 90 to 92% of the learning experience is hands-on. It's actually learning by doing, okay? We have the see, do, teach method Pam mentioned. That means that you've got to see what's going on. You've got to observe the actual work that is being done at your host site. And then we ask you to do it. We ask you to do the work over and over and over again, to do it in different ways, in different environments, to actually do it so you master the skills that you're expected to do over the 2-year time period. At the end of your 2 years, we'd like you to be able to teach someone else some of the skills that you have mastered over the 2 years. So you see up in the beginning, then you'll give you an opportunity to do the work 3 to 6 months in, a year and a half in, to keep doing. And then at the end of the 2 years, we'd hope you'd be able to teach others some of the skills that you master. But 90 to 92% of the work is actually hands-on learning, actually hands-on learning. About 8 to 10% are actual academic experiences. We have a learning management system that we've got that you would be expected to take some courses every single month through a web-based learning management system called CDC Train. But you'd be expected to do some of those academic programs and academic courses. They're short. Sometimes they're 10 minutes, sometimes they're an hour, but they're not long, actually academic classes. We'll host training events from CDC as well that will bring individuals to talk a little bit about social and cultural inclusivity or health equity or social determinants of health or public health law, for example. We'll bring folks to talk about budgeting. What does a budget look like when it comes down from Congress, and how does it get to the hands of the people who actually deliver public health work? This is our attempt to give you experience and exposure to a number of aspects with public health. But this is the BestFit model. I'll also put in the chat the link to the BestFit model on the CDC website. These are key variables. We've got a little bit more information on the website, but as you consider thinking whether to apply to PHAB or not, think about these 7 characteristics and see if you are the best fit for PHAB. Let's move on. This just gives you a little bit of an idea of where the associates are located. Okay, as you see, the 2019 associates started the program in October of 2019 and just graduated this past October of 2021. As you can see, we've got, I think 1, 2, 3, 4, 5. I think we've got 45 states that we have placed associates in, as well as Guam, the U.S. territories in the Atlantic, which are the U.S. Virgin Islands, and Puerto Rico. We also will place folks in Hawaii. We've got a couple of associates in Hawaii this year. We have about 3 associates in this year that started in October of 2021 that are placed in Alaska. Okay, we'll talk to you through the process of your application, which will start in January of this year and again next year. But we'll talk to you about where you would like to potentially be matched. What city and state would you like to move to in your relocation? Do you have the capacity to relocate to an Alaska assignment? Or are you in Ohio and would like to move to maybe Indiana, Kentucky, West Virginia, or Pennsylvania? We'd actually work together with you on the matching process so we get the most likelihood of success that you'll stay in the program, you'll enjoy the program, you'll be able to tolerate the changes in cultural and social dynamics and not feel isolated, but to truly enjoy the aspects of your new community for the 2-year duration. Let's move on to the next slide, please. As I mentioned, our 2021 associates started on October the 12th, a Tuesday after Columbus Day this past October. We had 183 new associates that started the program in October. This year, we're anticipating hiring between 200 and 215 associates to start in October of 2022. So this is a big year. This effort with coronavirus has really taken precedence with CDC. We're looking to hire associates to help fill the early career workforce gaps that an organization might have at the field level. So we've had 183 started in October. You can see the distribution of how many percentage have had bachelor's degrees, what percentage have had master's degrees, and even what percentage have had doctoral level individuals. The majority are bachelor's prepared individuals. As Pam mentioned, the majority are traditional associates right out of undergraduate or graduate school. This does not preclude somebody who is later in life or later in their career from applying to PHAB, as long as you are within 2 years of your most recent degree when applying to the program. I see a question that pops up that says, do veterans get preference when applying? Yes, veterans receive preference when applying. So if you are a veteran and you received your bachelor's degree within 2 years, or a master's degree, or even a doctorate degree within 2 years, and you are interested in joining the public health workforce as an associate, please consider applying. But veterans are given preferential status in the application process. Let's go on to the next slide, please. This gives you an idea of the host sites. The host site is an organization that will apply to receive an associate for the 2-year duration. Right now, the host site application process opened up this past Monday. It will last until mid-February. Every year, it's about a 6-week period. So next year, it'll open up in January. It'll go through mid-February. But this is a breakdown of the types of agencies that have applied to host associates in the year 2020. These associates are now in year 2 of the program. You can see local health departments. That's either a county or a city health department. 35% of our placements are at local health departments. You can see that these are the rural, more rural assignments that are located at the local level. About a third of our host sites are at the state health departments. That means they're at the capital of a state, or if the state is centralized, meaning that all the local health departments are state employees, they might be based in the state, but the majority are at the state capital, working on public health programs for the statewide initiatives. We've got 4% that are in the territories. The U.S. territories, there's about 5 or 6 U.S. territories. In the Pacific Islands, okay, in the Pacific Ocean, there are Guam, which is a U.S. territory, American Samoa, which is a U.S. territory, and CNMI, the Marshall Islands, which is a U.S. territory. Those are the 3 U.S. territories in the Pacific. There are 2 U.S. territories in the Atlantic. That is Puerto Rico and the U.S. Virgin Islands. So there are 5 territorial health departments that associates can be placed in, depending on their interest and their financial capacity to relocate, but 3 in the U.S. Pacific and 2 in the Atlantic. We have many that are tribally focused, okay, meaning they're working with U.S. tribes, American Indian or Alaska Native tribes across the U.S. These are very rural environments, many in the Southwest, but they're all over the United States. We're trying to increase our presence with tribally focused agencies. So if you have an interest in working with tribes or a tribally focused assignment, this is a great program for you. This is a great experience in working with U.S. Tribes or tribally focused assignments. We have other organizations that are non-governmental organizations, meaning, for example, a community-based organization or an academic organization who can give the associate experiences and opportunities to actually meet the competencies. Someone says, JT, I'm a Parks and Recreation department with the federal government. Can we apply to host an associate? The answer is, if you can provide a list of work activities that gives the associate opportunities to meet the competencies of the program, you've answered your question, okay? So it doesn't matter the type of organization. There are many community-based organizations. For example, in Atlanta, we have a number of community-based organizations, which is the next category, which serve the HIV/AIDS community, okay? For example, we have AIDS Atlanta, a community-based organization that is funded directly by the federal government, that we can also actually supply an associate given to a community-based organization, or an academic institution, or another federal environment. Like I said, the public health, what did I just say? That the natural forest environment, okay? The federal government can actually apply to receive an associate as well, as long as they can provide them with experiences and opportunities to meet the competencies of the program. So you can go to any one of these kinds of locations across the US or US territories. Next slide, please. Gosh, this is some of the program areas. This is a real exciting, I love this slide because it talks about the variety of experiences that associates will get. They can work with STD, sexually transmitted diseases, tuberculosis, and/or HIV prevention, other communicable diseases. They can work in chronic disease, as Pam mentioned, childhood obesity, nutrition, cardiac disease prevention, cancer research, and so forth and so on. Environmental health, public health emergency preparedness, immunizations. Has anyone heard of what's going on with immunizations across the country right now? All right, the vaccines and so forth. Injury prevention, okay? Intentional injuries, unintentional injuries, and so forth. Maternal and child health, tribal health, and so forth. Those are all areas that the associates can work in. Every associate will work in a different area. Okay, we call the program a transferable program, because you will acquire skills that you can then transfer to any subject area that you have a professional interest in after the program. So this is what we call a generalist training program. So if you're placed in a chronic disease prevention assignment, you're not going to get any different experience than you will get if in an environmental health experience. The subject will be different, the topics will be different, but the skills you acquire will be the same. You'll be able to deliver a presentation. You'll be able to write a report. You'll be able to collect data. You'll be able to analyze data. You'll be able to write a report on data and so forth. The topic area is not the relevant issue. It's the skills that you'll be building over the 2-year duration. But this is a variety of public health program areas and subject areas that you could possibly be matched with over the 2 years. In the matching process, we'll take into account if you have an interest in a certain area. So you have an interest in cancer prevention or smoking cessation or oral health. We'll take into account your professional interest, the location on where you are interested in relocating to, as well as the applications that we have in the pool this year. So for example, if you have an interest in oral health in Northeast Ohio, then we'll look, do we have any applications from Northeast Ohio in oral health? If not, we might say, we don't have this in Northeast Ohio, but we have it in Central Pennsylvania. The Pennsylvania State Department of Public Health has an oral health application. Would you be interested in considering Harrisburg, Pennsylvania? Or you might say, I've got family that lives in Northeast Ohio. I'd prefer to be in Northeast Ohio. We have an STD assignment in Northeast Ohio. Would you be willing to take an STD assignment in Northeast Ohio? So whatever's more important to you, is the program area or the subject area important, or is the location more important? And we work through individual needs and so forth according to what preferences associates will have throughout the application matching process. Let's move on to the next slide, please. This is the eligibility criteria that I mentioned earlier, okay? You've got to be a US citizen, a permanent resident, or a US national to actually get your application in. You've got to have a GPA on a scale of 4.0. You've got to have at least a 3.0 grade point average. This demonstrates your intelligence, the capacity that you have to acquire new academic information that is provided to you through the academic process. You've got to receive a university degree in the last 2 years. So after July 1st of 2020, between July 1st of 2020 and July 1st of 2022, you have got to receive your degree within that time period to be eligible to apply this year. If you're graduating next year, you can apply next January. If you're graduating in 2 years, you can apply in 2024. But the cycle is a 2-year window that you've got to be able to receive your degree, okay? Let me see what else we have. We've got to be committed to public service. This is a public service entry early career program. You've got to understand the demands and the requests of the public and the diversity of the public. If you're expecting to have a high-paid position in a tall building in the beautiful Manhattan, this is not the program for you. This will not happen. Many of our programs have desk space that are very limited. They have many people wearing the different hats in the organization. They're underfunded, they're undersupported, but you have many, many hats, but you've got to be dedicated to public service and the good of humans in the United States and its US territories. You've got to be willing to relocate at your own expense. This is a key aspect. And unfortunately, the CDC will not relocate individual associates from where they currently live to their host site for the 2-year duration. You've got to be able to relocate at your own expense to your host site, and then after the program to relocate to another city and state after the program, right? So that is a key variable that you've got to take into account. You've got to be passionate about public health. Not everyone grows up saying, I want to be a public health professional. Many folks will actually stumble into public health through taking a class in undergraduate or graduate school, or volunteering at a health fair over the summer, and or doing HIV outreach or education information, or working with mothers and working with baby car seats and so forth to prevent injuries. But you've got to have a passion for public health. You've got to be willing to commit to the PHAB program for 2 years. It starts in October of this year. It'll end October of 2024. Next year's class will start in October of 2023 and will end October of 2025, and so forth and so on. We have 2 classes of associates in the program at any given time. We have those in year 1 of the program. We have those in year 2 of the program. Currently, we have about 350 associates all dispersed throughout the US and US territories working either in year 1 of the program or year 2 of the program. But we really do want to have individuals who are committed to working for 2 years in PHAB. It's a great opportunity. You'll be working for CDC, you'd be working at a local or state health department or a non-governmental organization to help them with workforce gaps that they're unable to fill. You'd be adding such value into their organization. We talk about something called a co-star model to our host sites who apply. The A of the model stands for your work activities should align with their goals. A, align with their goals. So the work that you'll be doing will add value to that host site. You will be an integral part of their workforce. You'll be virtually indistinguishable from the external. Someone will see you sitting in an office. You'll have a badge that says the local health department's ID badge. You'll have access to their internet systems and intranet systems. The only time you'll be identified as a CDC employee is when you come to Atlanta for one of 3 in-person trainings that we will fly you back to Atlanta throughout the 2 years. You'll get to see us here at headquarters in Atlanta. You'll get to meet subject matter experts here in Atlanta. You'll get to see CDC campus in Atlanta. You'll get your badge and so forth. We'll integrate you as part of the CDC throughout one of the 3 in-person training events that we'll host throughout the 2 years. Okay, let's move on to the next slide, please. This is, let's go back one slide. Okay, great. How are we doing on time, Tracy? I don't have a watch in front of me.
We only have 10 minutes left.
Okay, all right, no problem. I'm gonna zip through these, and I would like to get to some of the questions because I know there's a lot of questions coming in to the Q&A. The application process is a 3-phased approach. The number one, the application itself, you have to get your job application in through usajobs.gov, usajobs.gov. Pam, would you be kind enough to put that in the chat for the candidates? usajobs.gov. If you are interested in applying to PHAB, I would suggest that you get on this website now and set up a profile. Right? This is the very first step in the process. The application will open up in another couple of weeks. The dates are going to be the 18th of January, through the 25th of January. And Pam, if you would put that in the chat as well, the 18th of January through the 25th of January. This is a very short window. I would hate to have you spend 2 or 3 days setting up a profile. You do not have to have an application ready to set up a profile. So I encourage all of you, if you're interested, even if it's going to be in a year from now or 2 years from now, set up a profile in USA Jobs, okay? Request to be notified when a GS5 level position is announced. GS stands for General Services. 5 is the early career entry level position level for an associate. So when the position announcement is posted and broadcast, you'll get an email saying a GS5 position has been posted. You'll click the link, you'll be able to go in and actually apply to the position announcement. But go in to usajobs.gov and set up a profile now. After we get your profile, after we get your application, Human Resources Office will then send us, the program, a series of individual candidates who meet the criteria to be considered for the position. Okay, it's called a certificate. They'll send us a certificate with the names of candidates who are eligible to be considered. We will send all of you an email requesting that you submit a personal statement, which is no more than 750 words or less. And we'll ask you some questions, like, for example, how did you get interested in public health? What kind of career are you interested in pursuing? To see your capacity to look at your E of the BestFit model, effective communication skills in writing, okay? Can you string 2 words together and make a complete sentence and convey a thought that's pulled together and so forth? The third step of the process will be a virtual interview. We'll actually conduct it via Zoom with you and a candidate and an individual from the leadership team, like myself and Pam from CDC in Atlanta. We'll talk to you a little bit about your experience. We'll talk to you a little bit about what your interests are. We'll talk to you about how you've addressed things in the past, how you work with teams. We will not ask you questions about public health, okay? Because remember, you have to have little to no public health experience. It's not a quiz. It's a mutual experience to be able to, us to tell you a little bit more about PHAB and you to tell us a little bit more about you. That's all we're interested in, you to talk about yourself and to see how you present yourself and see what kind of language skills you have available and the capacity that you have to see if PHAB is really the right fit for you. But that's the 3 steps of the application process. Do not feel bad to go into usajobs.gov and set up a profile now, even if you're going to apply in a year from now or 2 years from now. It will only behoove you. usajobs.gov. That's the first step in the process. Let's go on to the next slide. All right, here's the timeline. There's an error on the very top slide. I just want to make sure that you're aware. The application period opens up January 18th through the 25th, not the 17th through the 24th. That's 18th through the 25th. Applications open up in another couple of weeks. So if you're interested and you will receive your degree between July 1st of 2020 and July 1st of 2022, apply. I would consider you to apply. You're eligible to apply again next year. If you don't get selected and matched this year, you're eligible to apply again next year, as long as you receive your degree within 2 years of the time frame. Host sites are applying now to be considered potential host organizations through the middle of February, okay? Between February and April, we'll review applications. We'll actually ask you through April to submit a personal statement. We'll conduct an interview through Zoom or Microsoft Teams. And then in May and June, we will actually candidate match between you and a host site. You might not hear anything other than send us a personal statement and set up an interview. And that's it. That's why the F of flexibility is so key with this program. Some people want to apply and know within a week or 2 whether they get a job or not. This program will not make you very happy. It will take 6 months before you start to get a response back from CDC talking about matching potential. So you've got to keep that in mind. July and August, we'll talk through the human resources process to accept your matches, and then the program will start every October. It's the day after Columbus Day that you will have to be relocated to your new host site, city and state within commuting distance on a daily basis and be there available to participate at your host site the day after Columbus Day. Okay, let's move on to the next slide. All right, so we got you set up. cdc.gov/PHAB. If you have any questions, send an email to that email address. That's a very simple email address. You can Google it on CDC PHAB. It'll come up as well, but cdc.gov/PHAP, Public Health Associate Program. We'll get your questions answered. We'll talk to you on the telephone. We'll talk to you about opportunities that you might have within PHAB or CDC. If PHAB's not the best program for you, we'll talk to you about other opportunities that are available for training opportunities and so forth. A question comes into the chat is, do you have to have letters of recommendation? No, we do not accept letters of recommendation. We do not accept letters of recommendation. We'll go through the personal statement review process. We'll actually go through the interview process, and we'll make our selection based on those three characteristics: the application you submit, the personal statement, and the interview aspects. Okay.
JT, can you reiterate again the time frame for graduation? We got a lot of questions about
Sure.
based on when my last conferred degree was.
No problem, no problem. You have to have your last confirmed degree for this year's application between July 1st of 2020 and July 1st of 2022. So if you're graduating this spring semester and you will get your degree before July 1st of 2022, you're eligible to apply this coming next couple of weeks for this year's class coming in October. If you received your degree before July 1st of 2020, you're not eligible to apply for PHAB. I would suggest you look at a site that's on the CDC website through cdc.gov/fellowships. Fellowships, FELLOWSHIPS, fellowships. That will give you a list of 40 to 45 other training opportunities that you might be eligible to apply for. Just because PHAB is not the best program for you doesn't mean that there are not other opportunities available. Okay. Thank you for whoever put it in the chat. cdc.gov/fellowships. Perfect. Okay. All right. Let's go through some of the questions in the chat. Tracy, do we have time to go through some of the questions in the chat?
We do have a couple of minutes, or we can, if you have a little flexibility, we can take a couple minutes over, but
I'm okay to stay as long as folks are interested, and as long as you like me to, I'm okay.
okay, let's give ourselves an extra 5 or so minutes, but there are a ton of questions that are, I don't know, Pam, if you've been also reading them and want to summarize some of them, but towards earlier on, there were some questions about the educational opportunities received, and if you receive any certifications or anything like that throughout the program.
Yes, that's a very good question. Thank you, Tracy. The academic portion of the program is about 8 or 10%. That means that you'll be sitting in classes, you'll be sitting and you're taking online learning opportunities, you'll be sitting in individual instructor-led training courses, you'll be sitting in orientation at your host site. It's really the academic part of the program. The host site will submit an opportunity for them to submit training experiences and what they would propose that you would experience as part of the actual 2-year training at their host site, in addition to the work that you'll be doing. So CDC has a large curriculum that we will include as well. We have about 30 or 40 courses that we expect you to take as part of the academic portion of your experiential learning experience for 2 years, which will come together to Atlanta 3 times over the 2 years for 1 week each week, depending on travel restrictions. We've been doing it virtually the past couple years, but hopefully we'll bring you guys in together to network with your other classmates, meet some of the subject matter CDC experts and so forth, and go from there.
There are a lot of questions about citizenship. You want to just touch on that again?
Sure, no problem. You've got to have one of 3 criteria to be considered as an applicant for PHAB. Number 1, you've got to be a U.S. citizen. Okay, you've got to be a U.S. citizen. You have to be a permanent resident or a U.S. national. You've got to be one of the 3 opportunities: a U.S. citizen, a permanent resident, and a U.S. national are the 3 criteria that you have to meet to be able to be considered for an applicant. There are other programs at CDC through the actual application that says through the CDC fellowship site that I gave the link to that could possibly take other individuals who are not one of these three categories, but you've got to be a U.S. citizen, a permanent resident, or a U.S. national.
There's some questions on can they enroll in a master's program, be it online or face-to-face during the PHAB training 2-year program?
That's a good question too. We defer that to your judgment. We defer it. You've got to work for 40 hours a week, 8 hours a day at your host site, from 8 to 4:30 or 7 to 3:30 or 9 to 5:30, whatever the time frame is. We call that a tour of duty. It's very militaristic with the federal government, but we call that you've got to work 8 hours a day, 5 days a week at your local host site. If you can work in classes in the evenings or the weekends, and you can actually juggle work and school, it's up to your discretion. We don't expect you to do school work during the workday if you're taking an online degree, if you're pursuing an online degree. All right, so just make sure that you're able to judge it and balance the responsibilities accordingly, but you've got to spend 8 hours a day, 5 days a week at your local host site.
I saw a lot of questions, again, talking about the matching process and how much say the candidate has about where they end up located, and also related the salary of different cities.
Yes, no problem. Good question. The matching process sometimes is more located in Atlanta here than with the associate, but we ask the associates input on before we start the matching process. We'll ask the associate, what states and what cities do you have a preference to relocate to? We'll ask you your top 3 cities and states. We'll ask you, what subject area would you like to be considered? Okay, if you have an interest in working in HIV prevention in the city of Chicago or surrounding suburbs of Illinois, Indiana, or Wisconsin, we'll talk to you about that. Before we actually make a match, we'll call you and say, hey, we don't have an STD assignment in Chicago. We have an STD assignment in Perrysville, Illinois, which is about 3 hours south of Chicago. Would you be interested in considering that opportunity? Or we'll say, we don't have an STD assignment in Chicago, but we have a chronic disease related assignment in Chicago. We'll try to do our best to match associates with the area, the geographical preference, and the subject area preference of their choice. 99% of the associates got their first or second choice in the class that just started. So we do our diligence to make sure that the match is a potential success and that we have the most likelihood for success in keeping you in the program for the 2 years. Any other questions coming in that we can kind of summarize?
Someone wanted to know, how many times can they apply? And I hope I answered it. I let them know as long as they have not been out of school longer than 2 years.
That's correct. That's correct. You can technically apply 3 years in a row.
3
the
years.
year you're going to graduate, the year after you graduate, and 2 years after you graduate. All right. So you can technically apply 3 years in a row. We have many associate candidates who have applied for year 2. For the second year in a row, and they will get accepted. But we have a large variety of number of applicants. So many qualified candidates will not be accepted and matched, unfortunately. We're going to hire 200 to 215 associates. We have a number of actual positions that people will apply for. But sometimes we'll have candidates who are qualified who unfortunately we just don't have the room for. So we'll encourage them to reapply again, but you can apply technically 3 times in a row if you have the capacity. Also, Tracy asked about salary. Salary is in the public domain. It's in the opm.gov website. OPM stands for Office of Personnel Management. opm.gov. Pam, if you'd be kind enough to put that in the chat as well.
Got it.
This will tell you what a GS level of the employee's salary is. The base salary comes in at a GS5 or General Services Level 5. The salary is about $36,000 to $38,000 base salary, plus there is a cost of living adjustment that is offered to an associate. Okay, so for example, the base salary for the GS5 is $38,000. If you're in New York City, you'll get a cost of living adjustment to offset the potential expenses associated with living in the state of New York and the city of New York City, as opposed to living in central Idaho, where the cost of living is a little bit less. But there's a cost of living called COLA, C-O-L-A, cost of living adjustment that is offered to an associate as part of the two-year training plan. Year 2 of the program, associates are promoted to a GS7. Usually it's about another $4,000 to $6,000 increase in their salary in year 2 of the actual 2-year training period. Okay. LA, cost of living is insane. You're absolutely right, Samantha. Okay. There's a cost of living adjustment. You're not going to make $1 million as an associate. Okay. You'll be able to afford the basic living expenses. If you can tolerate it for year 1, there is an increase in year 2 and year 3 of the program. You're eligible to convert to a CDC position at a GS9 level, which is an additional $4,000 to $6,000 to $8,000 bump. So in the first year, it's kind of tough. It's kind of tough, but if you can tolerate the salary for a year, you'll see an increase in your pay depending on your performance.
Okay. JT, I got one question that I'm not quite sure of. Someone wanted to know, they are a F as in Frank, F1 visa holder. Are they eligible? And I'm not familiar with the F1 visa holder.
I'm not either, Pam. If you are considered a permanent resident or a U.S. national or a U.S. citizen, the answer is yes. I'm not familiar with an F1 visa. What you can do, Pam, would you put the HRO help desk in the chat? HRCS@cdc.gov. HRCS, Human Resources Customer Service. HRCS@cdc.gov. That's a good question for them.
Okay.
Ask them, they'll be able to guide you on that question about an F1 visa.
Putting it in now.
And
Thank you.
I think if we also just post again the website and email for questions, there are literally over 100 questions we did not even get to, which is fantastic. I'm very excited, but I do think we need to wrap up. So I know you all will be able to answer any questions throughout email.
Yes, no problem. The email address for questions about PHAB is www.cdc.gov/PHAP. Okay, PHAP, perfect. That is the web address to actually link on to the web address. If you have a question, and you want to direct it to us at PHAB, you'll type it to phap@cdc.gov. phap@cdc.gov. Perfect. Thank you, Tracy. That will get you directly to the help desk at PHAB here in Atlanta. We're happy to talk to you about your specific requirements, specific questions. We'll talk to you through the process. We cannot guide you on the answers to questions, but we can talk to you about eligibility and criteria. We're happy to work with you one-on-one. Someone will call you back if you need to talk with someone. We'll exchange email addresses, whatever the case might be.
And then just to reiterate, this webinar has been recorded, and we will make the webinar and the slides, everything available to you within the next week, and it will be posted on our website as well. You will get an email back with the information on how to log in. So
great, thank you.
Thank you all for logging in today.
I appreciate it. I would encourage everyone to consider applying for the program. This is a great program. It's a great opportunity for the right person, the right matches. Please consider applying. We would love to have many of your applications come into PHAB. So thank you. I wish everyone the best, and have a happy new year, everyone. Take care.
Thanks.
Bye now.
Thank you.